As I said, I'm not the one that came up with the science of inflammation as the root of these problems. But what we do here at Colleagues Wellness is apply that into the clinical setting. So why haven't others done that? Because several different reasons. One, there's silos of medicine. So for example, if we have a chronic lung problem, we go to our pulmonologist, and they're really good at managing our chronic pulmonary and lung problems. But they are completely separate from what happens in the GI clinic, or what happens in the migraine clinic, or what happens in the rheumatology clinic. What we found from our experiences, both as the division head of pediatric emergency medicine at the University of Maryland and as the founder of Kindermender, we're talking about the same kids. The same child who ended up being a frequent flyer, so to speak, at the pulmonary clinic, also has an appointment tomorrow at the GI clinic, also has rheumatologic issues, and also sees the dermatologist. But nobody else has been able to connect those dots, because we go, as many individuals do, providers also go through life in tunnel vision. And the moment you look at the big picture and you connect the dots, you see a connectedness, a pattern that wasn't visible before. It was always there. We just didn't appreciate it. One of the innovations in our prior urgent care center was displaying to the provider at the point of care all of the individual's past histories, not just having to click here and click there, or flip through this paper or flip through that paper. Seeing that pattern became quite revealing to us. When a child would come into our clinics for digestive issues or vomiting or diarrhea or belly pain, and I saw that I had seen them a couple of months before for big mosquito bite reactions, or I saw them in the fall or winter for respiratory issues, now all of a sudden I said, now I see what's going on. The same thing that inflames their mosquito bite is the same thing that makes their respiratory airways inflame more, and now it's inflaming their tummy. So rather than hunt for this mysterious food that they may have eaten, or something else that may be the culprit, I can go back to the conduit, the bottom of the iceberg. So speaking of icebergs, one of the examples I use to make sense of this is, imagine there is this giant iceberg, but just under the surface of the water. It has different peaks that it shows at different times. So one peak may be the respiratory peak, or another peak may be this darn rash that keeps popping up, or molluscum as people know it, or warts, or different skin manifestations, or another one may be tummy or digestive or constipation issues. What we don't see usually in traditional medicine is that there is this giant iceberg that connects these different dots. Seeing the iceberg on the bottom now helps us, instead of fighting all these different futile, frustrating battles with these different peaks of the iceberg, now we can talk about, how do I reduce the swelling of the iceberg? How can I make changes that bring everything down? And all of a sudden, things start falling into place. No longer this medicine and that medicine and this antibiotic and this antibiotic and this imaging and this specialist. I have one common source of focus that brings symptoms much more manageable. We don't fix things. We don't get rid of things. We make things more manageable.